Hey guys, welcome back. Today we are talking about sleep again. So in our last video, I talked about why sleep was so important, especially as it relates to someone going through cancer treatment such as yourself. You know, we talked about 5 different reasons why getting enough sleep is so important. So today I wanted to give you some practical tips and steps on helping you to fall asleep faster and to improve the quality of the sleep that you are getting. So the first tip that I want to give you relates to the number one reason I think that people have trouble sleeping, especially when they're going through cancer treatment. It's because you're anxious. You have a lot of anxiety and you have a lot of thoughts going through your mind. And when your mind is racing like that and you have so many thoughts, it's really hard to rest your mind to go to sleep, because you lay down and then you're still thinking about all of those different things. So to calm your mind before you go to sleep, it's important to develop a routine that calms your mind and your body. That routine always starts with trying to go to bed at the same time every day. Make it predictable so your body knows when it's time to shut down. Second thing you want to do is you want to incorporate activities that calm the body. Things like a warm bath, a warm shower. You may want to light some incense or have some fragrance in the room, light some candles. You may want to listen to some calming music or some calming sounds, or guided meditation is always good. Journaling or reading a devotional, those things are also very good to calm the mind before you go to sleep. Journaling in particular, I like because it helps you empty your mind of thoughts that may be bothering you. So if you're somebody who suffers with a lot of racing thoughts and anxiousness, journaling before you go to bed is a great way to empty your head of those thoughts. So that's the first tip that I would give you to help calm you so that you're able to go to sleep and have better quality sleep. So the second thing that I would say is really don't do things that are too stimulating to your mind right before you go to sleep. So it goes back to what we just talked about. You want to do things that calm the mind. You don't want to do things that stimulate the mind. So you don't want to watch TV with a lot of action and adventure, things that are going to stimulate the mind. You don't want to play video games. Those things, stimulate the mind before sleep. You want to minimize your screen time. So computers, cell phones, you don't want to have those on and interact with those things right before you go to sleep, because the blue light from them can actually keep you awake. Second thing that I talk a lot to my clients about is not sleeping during the day. As someone undergoing cancer treatment, you may find that you're significantly fatigued. And although it is important to get rest when you need it, you don't want to take really long naps during the day, because when you do that, you're going to train your body to sleep during the daytime and not at night. So you want your body to sleep at the time when it's supposed to sleep. And if for you, that time is at night, you want to sleep at night. Now, if you're someone who works during the night and you sleep during the day, then it's perfectly fine for you to take a nap, sleep during the day, because that is your body's sleeping time. But if that's not the case for you, you want to train your body to sleep at night. Be very intentional about not going to sleep during the day. Third thing I want to, or maybe this might be the fourth thing at this point, is you don't want to eat within 3 hours of going to bed, because if you eat within 3 hours of going to bed, that food is just sitting in your stomach and it can cause heartburn in a lot of people. So if you're finding that you're having a lot of heartburn, you definitely want to move that last meal window much earlier in the day so that you're not eating within 3 hours of going to sleep. You also don't want to drink anything with caffeine in it within, I would say, 5 hours of going to sleep. So things like coffee, things like caffeinated teas, you want to, not drink those kinds of drinks before you go to bed, because they have caffeine, and caffeine is a stimulant. So it's designed to actually make you more alert. So you're not going to get good sleep or sleep at all if you take those things right before you go to bed. You also want to be mindful that there are certain medications that also have stimulants in them as well. Things like some pain medications like Excedrin have caffeine in them. Some of those powders. I think BC powder may have caffeine in it as well. There are also some medications, some decongestants, some allergy medications that also have stimulants in them that keep you awake. So you want to be mindful of taking those types of medications before you go to bed. So those, and the last thing that I want to mention is if you snore, someone has told you that you snore or you snore, then this will be a great time to go in and see your primary care doctor and have them order a sleep study for you. A sleep study is where you're monitored while you sleep, and it's able to determine if you have periods of time during your sleep where you stop breathing. Because if you have lots of these episodes where you stop breathing, we call them apneic episodes, then that disturbs the quality of your sleep. So even though you feel like you've been in bed for 8 hours, you get up and you don't feel like you slept at all because you're stopping breathing, your body, you're not getting good oxygen and you're not getting good sleep. So there's some medical intervention that can be done if it's determined that you are having these episodes where you're not breathing, and getting those medical interventions done will significantly improve the quality of your sleep and you will feel so much better. So hopefully this video was helpful. If so, please like the video and subscribe, and I will see you guys in the next video.